Good afternoon and welcome once again to our weekly COVID-19 public health update with Montgomery County Executive Mark Elridge. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today is Dr. Earl Stoddard, who's Assistant Chief Administrative Officer, as well as Sean O'Donnell from the Department of Health and Human Services. As a guest today, we have Ian Anderson, Senior Director of Research for CBRE. With that, reporters, remember, if you will have questions during the Q&A portion of this presentation, use the chat. And with that, I toss it to you, Mr. County Executive. Good afternoon.
Good afternoon, and good afternoon, everybody, and thank you for joining us today. I'm going to start talking about today's 55-plus Barbecue Bonanza. Our Recreation Department was hosting over 400 senior citizens at Smoky Glen Farm in Gaithersburg for a fun-filled day of food, activities such as games, crafts, nature walks, softball, and line dancing. And I took the time to thank people there for the vigilance and patience and the sacrifice of not seeing each other, and for spending so much time on their own during the heart of COVID when they had so many loved ones that they would have liked to have been able to see during the pandemic. We all shared that sense of loss, and it was really nice to see people together for the first time in 3 years, where they were able to go out to a picnic and enjoy each other's company. We prioritized our senior population during the pandemic. Our seniors did what they needed to do to keep themselves safe, and since the vaccinations arrived last year, we've consistently held the highest vaccination rate for our 65-plus residents, and these efforts have helped us have 2/3 of the nation's death rate when it comes to COVID. The things we did definitely made a difference in people's lives, and I appreciate the fact that people listened to the advice and took it. That certainly had an impact on how well the county was able to perform during this. The pandemic did make things very challenging for our older residents, but it's, like I said, wonderful to see that we can come back together and participate in events like this. A little update on the effects of COVID on the economy. You can see from the chart above that the county's unemployment rate has now dropped to 3%, which is about where it was before the pandemic actually hit. So it's been a long time, but the rate has, continues to come down. We're hopeful this is a sign of more businesses opening up, and particularly businesses extending their hours, which means they're able to employ more people. We're 27 months into this, and the pandemic and its hardships have had an effect on both residents and our businesses, and it's still reverberating through our economy. However, we've seen some good indicators of an economic rebound. Our unemployment rate, as I said, is lower than we were before the pandemic. Last June, the unemployment rate was 6.5%, so we've been able to cut it in half, more than half in the last year. We're also beginning to implement our Fy23 budget, which is a very strong budget. It allowed us to provide record funding to schools and affordable housing and climate change solutions, and we're also able to set aside 10% of our funds for our reserve, and we're providing long overdue and much needed compensation increases to our employees. And I want to particularly highlight the police department, where this year the council did pass the negotiated agreement, which allows us to become competitive with surrounding jurisdictions regarding police pay. This isn't being paid for through any federal COVID assistance or by raising taxes, and that's a long way from my first budget, in which I inherited a $90 million deficit. So it's nice to be able to work in a healthy environment and to be able to do things that we look forward to being able to do and had to defer during the times of COVID and when we were most economically stressed. There is a deadline for rental relief looming. We've been putting out rental relief in the county, and we're continuing to put those dollars out to the community. But I want to remind everybody that the deadline for applying for our fourth round of rental relief is looming. And so far we've received 2,400 applications, with 95% of those coming from tenants themselves and 5% being submitted directly by landlords. Next Thursday, June 30th, is the deadline, and we're going to put the link to this application in the chat. And we would appreciate any coverage or sharing of this link through your social media networks or your regular media networks. To apply for these funds, households have to meet the following minimum eligibility requirements. They have to have experienced a COVID-related financial hardship. That means if you lost your job, it had to be related to COVID, such as your employer shutting down or your employer reducing your hours. Households have to have a gross income from either 2020 or 2021 tax return or the previous 30 days that is below 50% of the area median income. And so you've got to be able to demonstrate that that your income was below the 50% area median income. I know there are people who are above that who are in the same boat, but with the limited funding that the county received, we had to make decisions on where to cut off the assistance, since the cutoff point has been around the most vulnerable in terms of their incomes. You have to have resided in Montgomery County since at least August 2021. You have to have an obligation to pay formally or informally, and you have to be behind on your rent obligation by at least 2 months. Besides immediate rent relief, we also want to move on the rent stabilization bill that will cap rents at 4.4% countywide. We're beginning to get tenants writing us in saying they're facing 20% rent notices. We have tenants, low-income tenants, being told that they're going to be evicted, and this is going to just compound people's problems. And with high inflation for our county residents, it's going to mean that people will likely lose their housing unless we're able to do something to mediate the effect of the rents. So this is substantially more at 4.4% than the county was allowing before, and we think it's defensible and will help people retain their housing, though 4.4% is not an insignificant increase for people. This is a national problem, and it would be nice if we could get some national action on it. In the absence of that, though, we have to treat this legislation with a sense of urgency and do what we can to help these tenants be able to maintain their housing in the county. Also, the county has a program out there for hotel grant applications. Many of our hospitality businesses continue to experience hardships from the pandemic as well, and our 4th round of hotel relief grant program is set to launch next week, July 1st. Montgomery County hotels with 10 or more rooms and bed and breakfast with 5 or more rooms are eligible to receive up to $500 per room in assistance. The ownership of these facilities must be based in Maryland and have suffered a loss of revenue of at least 25% from September 2021 through January 2022, compared to September 2019 through January 2020. Applications can be found online at the Montgomery County Business Portal, and we're going to put that link in our chat, and applications will be accepted there through July 22nd. Our leisure and hospitality businesses currently employ about 12% of our county's workforce, and the World Tourism Organization has predicted that this sector will not recover fully until 2024. So it's imperative that we continue to help where we can, and we're using ARPA funds provided by the state of Maryland for these grants. And to date, more than $6.8 million has been previously distributed to our hotels. So I encourage all eligible county hotels and bed and breakfasts to apply for this newest round of grants. We're also going to talk about the CBRE report, which is Life Sciences Research Talent 2022. This industry is critical to us evolving COVID from a pandemic to an endemic. As it changes, the life sciences industry obviously has played a major role in both vaccines and treatments, and Montgomery County happens to be the epicenter of a lot of that activity. The industry isn't just saving lives, it is a big business and a great opportunity in the county for sustained high-paying jobs and job growth in our county. And I'm glad that we're being joined today by Ian Anderson, Senior Research Director from CBRE, to highlight the recent report regarding life sciences talent. The headline from this report from Montgomery County in our region is that we have moved up to second in the nation as the best place to find the workforce that this industry needs. As you can see from this chart, the life science industry has continued to grow at the fastest pace on record. There's 131% growth in this sector over the last 20 years throughout our nation, and within Baltimore, Washington metro region, Montgomery County is the epicenter of this growth. As home to some of the nation's largest life science companies like United Therapeutics in Silver Spring or Novavax in Gaithersburg, and a host of other companies, private sector businesses, large and small, are recognizing the proximity to NIH and FDA, as well as our region's education and talent in the workforce, makes us unique and a desired location for their businesses. In fact, it was just announced this week that GSA has renewed its NIH leases totaling 350,000 square feet in 2 Bethesda buildings that will keep them at their current location on Democracy Boulevard for another 10 years. This is important and good news for the county, and I want to thank our congressional delegation for their advocacy and support to keep NIH in Montgomery County. And on our end, we're committed to growing this life sciences talent pool. Last year, we signed an important MOU between the county, Montgomery College, the Universities of Shady Grove, and the University System of Maryland, and our life science companies that will connect our students to this industry, providing them an incredible education experience while ensuring we provide the well-trained and well-educated potential workers for this industry. I know from talking to any number of companies that have come here or are thinking about coming here that talent is absolute one of their frontline considerations. They want to know that if they do arrive here, that there's going to be a building talent pool because they expect to grow, and they want to know that this area is going to be able to provide the talent they need. That's what we're aiming to do. And I'm going to turn it over to Ian to go over the report, and then we'll take any questions about it before we move to the rest of our weekly COVID update. So Ian, it's yours.
Sure. Thank you, Mark, and hello to everyone. Pleasure to be here. I'm calling you today from Montgomery County, Pennsylvania, where I'm based. I'm a senior director of research with CBRE. I head life sciences research. I also help with thought leadership efforts on behalf of CBRE in the Mid-Atlantic region. What CBRE does, really briefly, is for the most part, we have various avenues of our business, but for the most part, we represent landlords and developers of all sorts of different types of commercial real estate space. We also represent companies and other organizations who are looking to lease or own commercial real estate space. And so regarding the life sciences industry, we represent most of the largest biopharma companies in the world who are looking for space, looking to grow. And one of their biggest challenges that they tell us at this point is they've seen dramatic growth over the last several years. And for many of them, they've never had a harder time trying to recruit or retain life sciences talent. So I'll share my screen if that works. And so we created this report on life sciences research talent in 2022 to help our clients find, identify, and access the most favorable talent pools of life sciences researchers in the United States to help the industry continue to grow. Couple of things. One, our report was not industry-wide. It doesn't look at all the talent that the industry may use. It looks and it focuses on the core research functions of the industry, those life sciences researchers or those life scientists who are the ones who create all the innovations in the wet laboratories. It does not include a lot of the other occupations or functions in the life sciences industry that might be sales, marketing, even management, et cetera. So if I move to the next slide here, it'll show you some of the growth of these life sciences researchers, some of these specific occupations that we've looked at and we've examined in this report. We evaluated the top 74 life sciences markets in the United States and evaluated them on this talent. And it was all based upon a metropolitan statistical area. So it wasn't based on the county. We did that for a couple of reasons. One is because when our clients are looking to locate in certain places. They want to find the widest pool of talent that they can access. And so for the Washington, D.C. and Baltimore regions, we combine them into one. The Census Bureau considers that a combined statistical area. We did the same for San Francisco and San Jose. I think it's notable that you might probably call the heart of San Francisco, the San Francisco Bay Area's life sciences ecosystem in South San Francisco. And in obviously in the DC Baltimore region, the heart of the ecosystem is Montgomery County, and they have some similarities there. So they have about the same difference in distance between San Francisco and San Jose that you have between DC and Baltimore. And so, and then you have these regional universities around them. So we've seen this incredible growth throughout the industry. It continues to grow. Our clients are asking us, where do we go next for continued growth? And probably the biggest takeaway from our report is we used various criteria, mainly looking at one, where the biggest absolute numbers of life sciences researchers are located in these markets, what markets have the highest density of these researchers, but also where are the most graduates with life sciences expertise. And so based upon all that criteria, this is our rankings. It's a real testament to the region. And I'd say Montgomery County and the fact that the Washington, D.C. Baltimore market ranked #2, only behind Boston, Cambridge. We certainly have a little bit of skepticism from our colleagues and some in the San Francisco and San Diego area as to how high Washington, Baltimore, and actually New York and New Jersey scored in our rankings. But again, it gets back to the massive talent, the number of talent, the educational institutions, and we feel somewhat comforted by the fact that, I would imagine Amazon, when they went through their evaluation of markets around the United States for their HQ2, they probably uncovered the similar type of data here, which is the massive talent. Where do you need to go to grow? Where is the educated talent? Where are the university institutions, et cetera, when they chose the Washington, D.C. region and New York for their HQ2. So that's the big takeaway. Just a couple quick items, details, and I can wrap up here. When we really we look into where these occupations are located in all of these top 25 markets. A couple of reasons why the Washington-Baltimore region scored so well. One, it's pretty remarkable that this region has the largest number of biological scientists and microbiologists in the entire United States. And those are in those red circles. And then those orange circles, it has within the top 3 or 4 largest number of medical scientists, chemists, and what's becoming increasingly important for the life sciences industry is the high-tech industry, the software folks. And so we have one of the largest numbers of data scientists and people with mathematical science occupations. So that helped it show up exceedingly well, but it wasn't just that, it was also the number of educational institutions, those with graduates in biomedical and biological sciences. And so the Washington, D.C. Baltimore region was #3 in those number of graduates. Notably, not surprisingly, Johns Hopkins, University of Maryland, but I think it's become increasingly obvious to some in the industry that there's a lot of graduates also coming out of Georgetown, George Mason, Howard, et cetera. So some uncovered gems within the region people may be just beginning to notice. Lastly, and I'll leave you with this, another criteria that went into our rankings of this, which we saw a pretty impressive and surprising correlation that was somewhat unrelated to the life sciences industry, but the biggest cluster, the most successful life sciences clusters in the United States had some of the strongest correlations with the density of simply the population with any PhD, not related to just life sciences, but any PhD. So it reflects a very highly educated population in those regions, but also those employed in professional, scientific, and technical services. Essentially key value add white collar jobs. And so no other region in the United States scored as well, with those holding a PhD and having the percentage employed in professional, scientific, and technical industries. You can see here what the Washington, D.C., Baltimore region is really up with these elite top 5 life sciences clusters in the United States, right up there with San Francisco, Boston, and a key cluster in Raleigh-Durham. So with that, I'm happy to share the report with anybody, or I don't know if we're answering questions here, but you can also see the report. You can find the report either on CBRE's website, but I think you can even Google CBRE Life Sciences Talent Report 2022 for further information.
Thank you, Mr. Anderson, for that presentation. Reporters, if you have any questions regarding the report and/or economic issues, this is the time. Any questions for Mr. Anderson and/or the county executive? Going once? Going twice? All right, I guess we move forward with the public health update. Please unmute, Mr. County Executive.
So thank you, Ian, for being here again today, and I look forward to working with you as we plot our way forward. And I'm excited because, we're working with the University of Maryland to actually bring our graduate program to the county, and that would be the first of the graduate level located in the county. So it's nice to have all this activity around us. It's time to bring some of that activity here, and that's what we're working on.
Okay, thanks for having me.
Thank you. This week, our case rate is at 233 per 100,000. So you can see we've been steadily, more or less, going down with a little blip there at the end. This is about where we were last week. Our COVID hospitalization rate is at 7.3%, and we still are in the CDC's community level of medium. And I also want to send wishes for a speedy recovery to Councilmember Katz, who caught COVID earlier this week, and he's currently quarantining. I'm glad he's doing well, but this is a reminder that this virus continues to mutate and be prevalent in our community. The big news this week is the initial rollout for infants and toddlers from 6 months to 5 years of a new vaccine. This is the last significant group to receive their vaccinations. And we know there are lots of parents anxious to get their young children vaccinated as quickly as possible. So I just want to let people know what the state of the number of doses is, because this is really important. I don't want people to think that we've been given all the doses we're going to need to vaccinate children in this county. To the contrary, the county itself has about 2,000 vaccines we got from the state. And that's the number that's on hand by the county for an estimated 35,000 to 40,000 infants and toddlers in this age group. And we anticipate that we're going to continue to get more vaccines on their way. The state is also providing vaccines to local pediatricians, but to individual pediatricians, not in large quantities. So it's not available. The other 38,000 doses aren't out there someplace else in Montgomery County. There are small doses available with our local pediatricians. So the bottom line is we have limited doses, and they're likely to run out due to this initial demand. And in fact, if this is the level we get for the next couple of weeks, you can be pretty sure that we'll run out each week before we get the new doses in. That said, the best thing parents can do is check with their family doctors first. We know that some private practices, like the Capital Medical Group in Chevy Chase, are setting up their own clinics. And vaccine.gov is a great website that provides up-to-date information on where you can find vaccines and boosters near you. So use this site to identify where these vaccines are available. As far as our county clinics, we're going to start a handful of clinics that are being positioned around the county under our equity framework and goals. There are a lot of people who don't have insurance and don't have access to transportation, for whom getting their children vaccinated is going to be extremely difficult. And so, as we did before, we're trying to make sure that those who normally would be least likely to get it or get it early are also able to get access to the vaccines. There will be approximately 300 appointments per clinic, and this will be by appointment only. Right now, we're not doing walk-ups because you don't want people standing in line for vaccines that aren't going to be there. So it's limited this week. It may be limited for a couple of weeks. Similarly to the vaccine distribution for 5 to 11-year-olds, these vaccine doses are different from those used for teenagers and adults. They're smaller. While we want to vaccinate as many of these babies and toddlers as fast as possible, we are beholden to the supply, and as with previous groups, our clinicians will prioritize safety in this initial rollout. We saw a similar rush of demand with our 5 to 11-year-olds, but that was a larger cohort. We got through that demand in a few weeks, and we expect the same success with this age group. So be patient. And like I said, try to get your appointments. If you've got a private provider, see if they've got the vaccine, and if they don't have the vaccine, always check with the county to see what we're going to be structuring for appointments. We're going to post appointments at 3 p.m. on our vaccine page as supply is available, and that's www.govaxmoco.com. That's www.govaxmoco, one word sort of, .com. There's also a page specifically for this age group, and it includes more specific information on the Pfizer and Moderna vaccines that have been approved for this. The federal impact statement on the I-270 Beltway project is out. Last Friday, the State Highway Administration released the federal environmental impact statement on their plans to add toll lanes to I-270 and the Beltway. We're still reviewing this 26,000-page document, but our stance is the same as it's been. I continue to believe the design of this project is fundamentally flawed, far more expensive than it needs to be, and the study clearly finds that the choke points are going to continue to exist. In other words, if you're at the ICC in North, you will be in misery. In fact, as you approach the ICC, you will be in misery as those lanes collapse down to fewer lanes, since there is no plan and no date for when they intend to extend this highway up to Frederick. I've been advocating from the beginning that this thing go from the bridge to Frederick, that they not tell us they're going to come back in 5 or 10 years and do the upper part of this, because that's going to continue to leave large portions of the Beltway paralyzed, and there's no reason for that to have to be the case. And we're going to continue to hope that the administration, or the new administration, is willing to go to the federal government to try to get money from this project. Without money from the federal government, like we got for the Woodrow Wilson Bridge, so we're not doing something unheard of, and this is a major interstate highway with a bridge that needs to be replaced, let alone expanded, there's no reason to believe that we couldn't get some help. And any dollars we got from the federal government would reduce the burden on county residents and others who are trying to use the toll lanes. It's that simple. I mean, the toll lanes are designed to keep people on the regular roads who can't afford the tolls, and to keep the toll lanes flowing more freely. And so the fees are set so there's a measurable difference between riding the toll lanes and not. And on top of that, the fees, as we found out, are going to be very, very high at rush hour. So going to the federal government, I think, would be a wise and prudent thing. And it's hard to believe that that's not something that we didn't do from the beginning. But I'm hoping that changes either under this administration, or that the next administration coming in decides that it's a necessary thing to do to provide this additional support. Last weekend, we celebrated Pride in the Plaza. We had many events honoring and celebrating Juneteenth. We had great weather and we had big crowds. And this weekend, we're celebrating the county's Marquis Pride Month event, which is Pride in the Plaza in downtown Silver Spring. And it's on Sunday from 12 to 8 p.m. This is an all-day festival celebrating LGBTQ plus artists, businesses, and supportive nonprofits. And I look forward to attending and hope to see many of you there as the county shows its pride. And finally, I want to congratulate Mayor Browser on her victory in the primary last night. essentially assuring her a third term as mayor. Over the last 4 years, she's provided stable and effective leadership to her constituents, as well as our entire region through these unprecedented times. We do appreciate her partnership with Montgomery County regarding our toughest challenges, whether it was COVID or public safety, affordable housing, or combating climate change and economic development. So congratulations, Mayor. And now I'm going to turn this over to Sean and Dr. Stoddard for their updates.
Thank you very much, Mr. County Executive. So going into the, are you able to see the slides at this point? Okay. Going in very briefly into the some additional surveillance, just wanted to share with our media partners. We continue to track our neighboring cities, and we can continue to look across the national capital region at the COVID case rates and see where they're going. And much like our numbers are coming down, we're seeing that in other places across the East Coast and across the country. The latest update from CDC typing of the variants is that they are projecting that we're now seeing an increase in our BA4 and our BA5 variants in comparison to the BA2 and BA2.1.2 variants. And as you saw our numbers coming down, that's the decreases of those BA2 subvariants. And again, we are seeing some cases of the BA4 and BA5 across our region. But again, overall, our cases have been coming down in general, held a little bit similar over the past week. Again, this is nothing new, but just tracking within Montgomery County, we're seeing something that's been consistent across national data, which is even with a high number of breakthrough cases during the Omicron phase, those that still remain unvaccinated are significantly more likely to become a case than those who are fully vaccinated. It may be that many of the fully vaccinated cases are subclinical, that they don't have symptoms, and maybe they're not being caught. But again, that is an improvement over having more serious illness for the unvaccinated. Looking at our hospitalizations, our numbers of COVID patients, we have 99 COVID patients across all of our hospitals in the alternate care center. We're seeing a little bit of decrease from last week in acute care and a slight increase in our ICU patients. Again, that is some of the natural progression as some patients become, their disease progresses, where many of the other patients are now moved out of the hospital. And we do have 44 patients still at our alternate care facility in Tacoma Park. Still tracking the death rates both in the county and across the state. We did see some increased activity in May, and we're seeing right now a little bit in June as a result of this last wave, still far lower than what we saw with the earlier Omicron waves, and still a lower rate in our county than our percentage of population across the state. We still believe that the actions our residents are taking and the precautions they're taking, as well as the vaccination rates and booster rates, are helping to keep these lower. Speaking of vaccination rates, of course, they are very high for the 12 and above. Our 5 to 11 fully vaccinated rates are in the area of 64 to 65%. That continues to increase slightly over time. We should have a new age group to add to this in the very near future. One thing to mention to our media partners is the state and the CDC are shifting to a weekly reporting of the vaccination rates. So this will, I believe it'll be updated potentially on Fridays with the state. And again, we'll have that weekly for you all. Where we'll see the most movement is, of course, in the under 5 age ranges. You can already see that we are seeing the 5 to 11-year-olds come in for boosters, much as the other age groups continue to go up slightly over time. And we are encouraging everyone to get their boosters when they're eligible. The immunity wanes across all age groups, and so it is important to get those additional doses. And as you'll hear shortly, even with the younger age groups, a third dose has been incorporated with some vaccines. So the update on the under 5 vaccinations, late last week, the FDA approved the vaccines for both Moderna and Pfizer. The next day, the CDC endorsed those recommendations. The only slight difference here is the CDC endorsed the vaccine for the 6 months to 4 years with Pfizer and the 6 months to 5 years for Moderna. They have not met to discuss the 6 to 17 for Moderna. So those families who maybe have been waiting for a different mRNA vaccine for that 6 to 17 population, or even a different one potentially for boosters, that hasn't been reviewed and approved yet. But yes, the 6 month to 4 years, 6 month to 5 years, that was reviewed and approved. On Monday, our partners at the Maryland Department of Health updated their standing orders that we could begin the vaccinations. And on Monday, we began receiving vaccine. We received part of what we ordered. I'd have to check with our disease control and immunizations team to see if we've gotten the rest of it, but we did start to receive parts of that. So we do expect our vaccine amounts will go up this week. And then it may be a week or two before we get another vaccine shipment, just because of the breadth and scope of rolling out a new vaccine formulation to a very large number of providers, pharmacies, and health departments. Where can you get the vaccine? As our county executive mentioned, vaccines.gov is a great website that helps you look up vaccine availability. You can check off which type of vaccine you're looking for. Our colleagues at the Maryland Department of Health have a very similar engine that uses data with exclusive to Maryland. This is a screenshot from about 10 minutes ago that includes the pharmacies within 17 miles of Wheaton that have the 6 month to 5 year or 4 year vaccines. And that was about 29 pharmacies within this vicinity of Montgomery County. Some of these are Prince George's, maybe a few are Howard, but there are already many, many pharmacies on this. I believe shortly the health department clinics will be added to it, as will any pediatricians who choose to answer the survey and get put on this list. But we are recommending people contact their individual pediatricians. They may not want to list publicly, but they may have it available for their practices. A lot of the vaccine is going to those practices. And again, some is going to pharmacies. When you use these search engines, I do want to recommend to the public, they have information and details about those clinics, and they have contact information. Some pharmacies may only be giving vaccine to individuals who are 3 and older, based on their rules and regulations. So please look at that before you make the appointment. The county sites are doing 6 months to 4 or 5, depending on the vaccine, for our clinics. And again, this is what, if you go to vaccines.gov, you can see, you can check the specific type of vaccine you're looking for. We're encouraging everyone to get these vaccines as they're eligible. We know that the younger age groups are less likely to have serious illnesses, but can still spread this amongst their families or their contacts. And we did see an increase in hospitalizations amongst younger populations during the Omicron phase. And we don't know how the next variants will look in our area. So we are encouraging people to get vaccinated now. Just to briefly mention the slight differences, the Pfizer vaccine is 6 months to 4 years and is 3 primary doses, separated by, the first 2 are separated by 3 to 8 weeks. It's the family's decision of what time frame to come in for that second dose, but it needs to be at least 3 weeks. And then there's a third dose at least 8 weeks after that second dose. The Moderna is a 2-dose vaccine, and there's at least a 4-week period between the first and second dose. The only real differences with if there are populations who are moderately or severely immunocompromised. They are recommending that shorter interval, that minimum interval for first or second dose. And Moderna is actually recommended to have a third dose like Pfizer for moderately or severely immunocompromised. And we'll have all that clinical information available at our sites. Those were the updates we have from public health. I'd like to see if Dr. Sauter has any additional comments.
Thank you, Sean. I just want to reiterate a couple pieces to this. First off, obviously the role of the county is really the social safety net. Many of the pediatricians and primary providers, they're not necessarily always following an equity framework in the way that the county has from the beginning. And so we are working closely with our safety net providers, the dental clinic, some of our early childhood care providers, and our early social work with our early child care population to find and identify those families for whom they're unlikely to have a primary care provider and may not have the means to access a primary care provider. And so we are prioritizing in our distribution program and in our partnership with Montgomery County Public Schools, accessing that particular population that's disproportionately Black and brown to make sure that they have access in an equitable fashion with all of our residents to these vaccines for the youngest population. We believe that this is both obviously important from an equity standpoint, but as we have said with earlier populations, we know that there's been a disproportionate impact, and that because many of those participants are in group childcare settings, they may pose a greater risk of furthering community transmission, and we can break chains of transmission by addressing populations that are at the greatest risk. So I want to applaud the Department of Health and Human Services for their efforts to continue to follow that equity framework and to identify places that are important for us to reach. The other thing I want to highlight for today is that as the county executive requested a couple of weeks ago, we have gotten an extension on the FEMA public assistance notification. That notice came down yesterday. They will continue post July 1 to reimburse local counties for their emergency response activities in eligible areas. They will do so at 90% cost recovery as opposed to 100% for activities incurred prior to or on July 1st. Beyond that, it'll be 90%. So obviously there will be a local essentially match that's included in the costs moving forward. This is something we had planned for, and frankly, we will plan to continue our emergency response regardless of the reimbursement, but obviously it is very helpful for us to receive that notice as well. The last thing I want to do is I want to, on behalf of the county executive, thank the county council for the interviews of the Police Accountability Board members yesterday. Having sat in the room for those interviews, I want to thank again those applicants, both those who were selected, but those who we did not, for their willingness to step forward. And for the applicants who were interviewed yesterday, I was incredibly impressed with their answers to the questions. I think they reflected the values of integrity and being moderate in their perception, focusing on procedural justice and making sure that everyone feels that their voices can be heard and that they're going to get a fair shake through this whole process, both the police and the community together. So that's all I have for today. I want to thank, I guess we'll proceed to answer question and answers.
Thank you, gentlemen. I believe the first questions come from Steve Monell, Bethesda Beat. Good afternoon, Steve.
Afternoon. My first line of questions about the vaccine distribution. I think I recall Councilmember Jawando saying that compared to other age groups, there actually is kind of less demand for this age group. So I just wanted the health officials on the call can kind of contextualize that, just what you've been hearing, and also kind of the outreach that you're trying to do. I imagine as we get going down further down the ladder here, and for younger kids, there are a lot more questions about the vaccines kind of impact on younger individuals, frankly. So I'm just wondering if the health officials on the call can kind of answer those questions.
Thanks, Steve. You know, something we have seen as we've moved from our more senior populations down through each age group is that the demand has been slightly less each time, and we experienced that with the 5 to 11. We felt a very significant demand initially, especially as the initial supplies were more limited as they did distribution. But then it became more of a slow and steady process of bringing people in. And, you know, I do attribute some of that to the increased challenge of trying to bring a child and and coordinate the schedules of the parents and the children to go and get a vaccination. That's certainly a little more difficult than an adult just stopping by when they're available. So there's some of that. There's also some parents who do want to wait a little bit to see how this goes with other people they know and other children. And we understand that there is some of that. What we have seen in our county, though, is still a higher demand across the board than most other jurisdictions that are tracking this, and we are prepared for it. We also know how important it is to be inclusive of all parts of our county, all populations in our county early on, because that helps with the buy-in. It helps when you know there are other people who have gotten this vaccine safely, and so on. And, you know, the safety and efficacy trials were kind of two parts of what both of these manufacturers went through. And the safety data has been very, very good. And there was really no questions about that over the recent months. One of the challenges is looking at efficacy during a time when there are so many breakthrough cases. And I know the manufacturers looked at different ways of measuring efficacy and eventually provided data that made both the FDA and CDC feel confident that the benefits of these vaccines outweighed the risks. So that's what we're trying to, again, share with our community so that they can make these choices. And we have been hearing lots of interest for several months from parents, from childcare providers, that they're really excited about having these vaccines available.
And I guess just the kind of alluded to this about overall demand. Are you concerned about that, or because the vaccine's going, obviously through multiple avenues? I think back to the start of the pandemic, and it was a little bit more of a Hunger Games when the initial wave was happening and the vaccines were going out. I mean, how do you think this compares to that drastic, demand at the beginning of the pandemic?
Well, I mean, there was, at the beginning of the pandemic, the numbers were very, very different than what we're looking at now. But also, I want to show appreciation for the search engine tools that both the state and the federal partners have that make it a lot easier than at the beginning having to call all these different organizations to figure out and try to get appointments. Again, what we saw with the 5 to 11 was after a few weeks, we had plenty of appointments available, and it became easier for people. We could do walk-ups, which again becomes more accommodating for populations, to be vaccinated when they're ready, and not having to make an appointment. And especially for our populations, we try to make our materials available in multiple languages, and we try to do outreach in multiple languages, but it just becomes easier when we can get to the point, when we can get beyond appointment only.
The one thing I want to add to this conversation too is I think, if there's an initial reticence from some parents for their younger students because they don't believe necessarily that the risk outweighs the benefits, I think, time will also sort of temper some of those expectations, number one, as they see people get vaccinated and see that there's no ill effects for them. But number two, as they continue to see closures of their facilities or their I think we recognize that this disease has become endemic. It's not a question of whether you'll get COVID or not, it's how many times in a given year you'll get COVID. And I think as parents begin to understand that the vaccination will reduce the risk to their students of getting ill, not prevent necessarily, but reduce the need for quarantining and other procedures of that nature, I think they'll understand that there's a more pragmatic or practical benefit in addition to the health benefits that will change their cost benefit analysis with regard to the vaccination. So as they see that the risks are lower than they perceive them to be today, and that the benefits beyond just helping to reduce illness and preventing hospitalizations, but in terms of just practical value of keeping more students in the childcare settings or as they enter into school in school settings, I think that will change people's opinions over time, and that's what we need to continue to remind them and convince them of through sharing of data about the safety and just sharing of information about the outbreaks that we're seeing continually in our childcare settings.
Very thorough as always. The other thing I want to ask about actually is about this hotel relief fund. And I don't know if anyone on the call has this information, but in this latest round, I couldn't find how much money is available that they kind of be able to give out through these hotel relief grants. Is anyone able?
I don't know. I don't know if the county executive does, but I certainly don't. We could figure it out for you, Steve, and get it to you.
The executive was muted too. On the
Oh, sorry. I
I was trying to say it's 500 a bed, but I do not know the total.
And do we know the breakdown? A follow up, but the breakdown. You said ARPA funding. Do you know? Is it all ARPA funding, or is the county also?
I believe this was the ARPA fund.
That's all I have. Thank you, everyone.
Okay.
Thank you, Steve. I do not see any more questions from reporters. Going once? Going twice? I guess we're done for the day. Thank you, everybody, for joining us. Stay safe, and we'll see you again next time. Have a great afternoon, everybody.
Thank you. Talk to you next week.